My mission is to provide exceptional care to patients suffering from Parkinsonian disorders. So to me, that involves treating each patient as an individual, meeting each patient where they are at, assessing what their individual needs are, and then providing access to the specialists that are the best people to help with those particular needs.
Something that a lot of people don't realize about living with PSP, CBD, or MSA is that getting the care you need often means becoming a master coordinator. You're juggling appointments with your neurologist, your physical therapist, your speech pathologist, your social worker, all in different places, all on different schedules, most of them never actually talking to each other. You end up telling your story over and over, hoping someone connects the dots. It's exhausting, and it's the reality for so many families. But what if it didn't have to be that way? My guest today is Dr. Danielle Shpiner, a movement disorder specialist and medical director of the CurePSP Center of Care at the University of Miami. She's part of a growing movement to change how we deliver care for complex neurological conditions through something called interdisciplinary care, where instead of seeing specialists one by one over weeks or months, patients meet with an entire team in a single visit. The neurologist, the therapist, the social worker, everyone. And then that team actually gets together, talks about you, and creates one coordinated plan. It sounds simple, but it's surprisingly rare. And the result is that it's transforming how families experience care. In our conversation, Dr. Shpiner explains what interdisciplinary care really means in practice, how her team learned from the ALS community to build their model, and why she's now studying whether this approach actually improves outcomes like hospitalization rates and caregiver burden. We also talk about something that came up again and again, how telemedicine has opened doors for people who live far from specialized centers, and even for those who have become too ill to travel but still need expert care. Whether you're newly diagnosed, years into this journey, or a healthcare provider looking to do better for your patients, this conversation offers a window into what comprehensive and coordinated care can actually look like.
My name is Danielle Shpiner. I'm a movement disorder specialist neurologist and the medical director of the CurePSP Center of Care at the University of Miami Miller School of Medicine. I first got connected to CurePSP. Actually, I met Jessica Schurer at a site visit that I was doing with the Parkinson's Foundation. And I met through one of our mutual colleagues from the Parkinson's Foundation. So that's when I started learning about the work that CurePSP was doing. And then it was very much in alignment with a lot of the work that we were doing at the University of Miami. And so we applied to become our center of care. And we received that designation in, I believe, 2023.
Yeah, so given the background with Parkinson's, there's obviously some overlap with PSP and Parkinson's. How does that work for you and in practice for you?
So I noticed that a lot of patients who ultimately are diagnosed with PSP, there's a good number of them that are initially diagnosed as Parkinson's disease. And so I think it's pretty common that most movement disorder specialists, even if they tend to specialize more in one disorder versus the other, they usually end up seeing patients with both Parkinson's disease, PSP, and then of course MSA and CBD as well. And so, yeah, they have, there's obviously some very important differences, but some of the care needs are similar across multiple of those disorders.
Yeah, and what is your rare disease and your PSP, CBD, MSA population at U Miami like?
I would say they're pretty similar demographically to the rest of our movement disorders population. So Miami is a bit of a melting pot. We have a lot of people that come from all over the country and all over the world that live here. We have a very large Hispanic population. About 50% of our clinic population identifies as Hispanic. And I would say those numbers are reflected in our PSP, MSA, and CBD populations as well, which I think is a little bit unique across other centers in the US.
And so what was the decision? What made you interested in joining the network?
So I think there's a lot of opportunity with being a center of care, both in terms of providing really the highest level of gold standard care for patients with these disorders. Being part of the network also allows for a lot of opportunity for collaboration with other centers that specialize in treating these disorders. So you can share best practices, come up with new ideas and strategies. And that part was very exciting for us, as was the opportunity to collaborate on research opportunities, which are really important for our patient population.
Yeah, so I'm very interested and intrigued by the idea of interdisciplinary care, which is your specialty, but I don't really know too much about it. So could you maybe just explain what that means for like someone like me?
Sure. So many neurological disorders, including PSP, CBD, and MSA, can come with a lot of complex symptoms that are ideally managed by a whole team of healthcare professionals and not just by the neurologist. So, for example, that might include physical therapy, social work, speech language pathologist, a sleep specialist, a urologist. So, interdisciplinary care refers to there's a group of people of these different specialties who all work together as a team to take care of the patient.
And so how would this differ from like just traditional neurological care, the way that we think of it?
Sure. So traditionally, care has been delivered mainly by the neurologist, who then may provide referrals to other providers when needed, but maybe doesn't know them or communicate with them directly to discuss the patient. So in an interdisciplinary model, the neurologist still plays a central role and often leads the team, but works in a more integrated way with the other members of the team.
Is interdisciplinary care like a new idea? Like how long has it been around for?
So there's not a lot of literature out there on it in the atypical Parkinsonism, like PSP,
Mhm.
MSA, CBD world, but it's an idea that's been around for a while with other neurological disorders. So there's a lot of literature out there for it, in particular with ALS, which really kind of led the way in this kind of care model, and also Parkinson's disease. There's a lot of literature out there as well, and so I would say that I think a lot of people at centers of excellence have been doing this in some sort of way for a while, but the idea of developing those care models specifically for these disorders is a relatively new idea.
Right. And so when families come to you looking for care, is interdisciplinary care like the only thing you offer? Are they receptive to it? Like how does that work?
Yeah, so when families come to us, oftentimes they don't know what their needs are. So I think this model, there's different models of interdisciplinary care that can work in different ways depending on the specific needs of the patient. So first of all, we know that having to coordinate care among different providers and departments can be really overwhelming to patients and care partners. So we currently offer several different options to help make that process less daunting. So in one model, we offer something called a synchronous interdisciplinary care clinic. So that means that the patient comes in one visit. They get to meet with an entire team of different healthcare professionals who all specialize in treating movement disorder patients. So in one visit, they'll meet with our neurologist, our nurse practitioner, our physical therapist, occupational therapist, speech language pathologist, a dietitian, social worker, neuropsychologist, a mental health counselor, and a research coordinator. And then at the end of the day, the team all meets together and comes up with a coordinated care plan for each patient, which is then sent to the patient and followed up over phone. And then on the other side, we also offer asynchronous interdisciplinary services where we have this network of providers that we work closely with throughout our institution who may not, some of them come to our synchronous interdisciplinary clinic and some of them don't, but we're also able to facilitate referrals to them. And we have two fabulous patient navigators who actually help facilitate follow-up and referrals amongst this network for our patients who may be having difficulty coordinating a complicated plan.
Yeah, no, I mean, it sounds like a lot of moving pieces, a lot of important moving pieces. And I want to know, like, how common is this like across the country?
So that's an interesting question, and it's one we're actually doing a project right now to better understand. So we actually have a research project currently underway to study these different types of interdisciplinary models across the CurePSP Center of Care network. And that's a project we're doing for the first time. So no one's ever looked at that before.
And so you as a doctor, like, how did you learn these ideas?
I would say that my first exposure to this type of care model was actually when I was a resident. So in our third year of residency at my program, we all rotated through the ALS interdisciplinary clinic that our institution had, which is very well established. And it was the first time I really saw this type of model in practice. And I saw the benefits that it really could have for patients. And then, of course, through my experience in practice and in residency, I saw many times patients that were having trouble setting up appointments or coordinating referrals or accessing, services through other providers, like even within the same institution. I think it's something that can be challenging for patients to set up. And so I really saw, a good example of that model working well, and also the needs of the community.
I've talked to other centers of care directors before, and they've mentioned palliative care as another kind of growing, emerging idea. Does palliative care inform your strategy at all?
Yeah, absolutely. So we have everyone in our center has some level of training in delivering palliative care to patients with progressive neurological disorders. And so I think we all approach the clinic with that, some of those principles in mind. We've also, taken on some initiatives to improve the type of primary palliative care that we provide, even in our interdisciplinary clinic, for example. So a few years ago, we also incorporated, for example, a routine discussion of advanced care planning. What's a healthcare proxy? What are advanced directives? How do you set these things up into our interdisciplinary care clinic, so that every patient that comes through the clinic has the opportunity to learn about and discuss those with our team.
Yeah, I was kind of wondering about that, educating the patient and the families. That's a great program and idea, just giving them the opportunity to learn about it, because I feel like the average people are just it's a lot for them. So I see the value of that.
I think it's also really important that we have the same discussion and provide those resources to every single patient, because I think the whole idea of setting up an advanced directive or thinking about some of those issues can be really intimidating and overwhelming to patients. But one of the things we want to move towards in our clinic is kind of like removing the stigma off of it, that, really having a healthcare proxy is really something that everybody needs, whether they have like a neurodegenerative disease or not. So, we think that by routinely talking about these things and making it part of routine care, that it's going to help improve access to people and make it less intimidating to talk about these topics.
I want to talk a little bit more about the day-to-day of your center of care. So so families come to you, they kind of get a care plan, and what happens if that care plan is they have issues or it's not working as planned?
Right. So you mean in the interdisciplinary clinic?
Yes, sorry.
Okay, that's okay. Just to clarify. So the patients receive the coordinated care plan, and then one of our patient navigators actually calls the patient 1 week later to follow up to see how they're doing. Were they able to make the appointments for physical therapy, or were they able to reach out to the teams that they were supposed to reach out to? Do they have any questions? And we found that we've actually caught a lot of, we try to be proactive about that, so that if someone's having trouble with following up, we can be proactive about kind of catching those issues and helping them with it before they get to their next regularly scheduled follow-up appointment.
And yeah, so what feedback have you heard from families about just kind of the experience of being in an interdisciplinary care clinic?
Yeah, so we've actually received a lot of great feedback about the clinic. So a lot of patients really like the opportunity to have evaluations by multiple providers at one visit, because it reduces the amount of appointments that they have to try to coordinate. And then the other point that comes up a lot is that patients really appreciate the opportunity to meet with specialists that have experience with treating their conditions. So PSP, MSA, and CBD are still relatively uncommon diseases, and sometimes we've heard that, some of the therapists out in the community may not be as familiar with how to approach these patients. So even for patients, say, who live really far away from our center that may not be able to continue with our team for their regular follow-up, a one-time consultation with a physical therapist, for example, that really understands their disease and considerations for management and can give some counseling on strategies, can be really beneficial.
And have you noticed, have you found any specific outcomes that have improved since starting the clinic?
So that's also a great question, and a project that I'm really interested in. So I'm really interested in learning more about looking at outcomes from interdisciplinary care models and seeing if we can really, if this model truly improves tangible outcomes like hospitalization rates or falls or care partner burden and things like that. The truth is it's very challenging to study in a coordinated way, but it's a research question I'm very interested in and I'm working currently on collaboration with a few other centers to design projects to actually look at that.
Yeah, what would you say like the mission of your clinic is?
So my mission is to provide like exceptional care to patients suffering from Parkinsonian disorders. So to me, that involves like, treating each patient as an individual, like meeting each patient where they are at, assessing what their individual needs are, and then providing access to the specialists that are the best people to help with those particular needs. So, I think, an interdisciplinary care setting is the most, ideal way to deliver that level of care in a way that is accessible and easy for patients to access.
So I want to get a bit into some of the challenges. So
Sure.
obviously PSP, CBD, and MSA are rare diseases. A lot of doctors we hear from families are not too familiar with these conditions, obviously misdiagnoses Parkinson's a lot. And so running a clinic, how do you educate, specialists outside of neurology about these diseases?
Okay. Yeah. So I think we do this pretty well through a few different ways. So the first is, I think, looking for opportunities to provide education through lectures at conferences. So I'm always interested in opportunities to present to audiences outside of movement disorders or neurology. So last year, for example, I was invited actually to speak at a primary care conference, which is a group I don't get the opportunity to get in front of often, but it's a good opportunity to start educating people about like what are some red flags or signs that you may be dealing with something that isn't just regular Parkinson's disease. The second is, I think, keeping an eye out for opportunities to collaborate with other specialties. So I love working on interdisciplinary projects because I love hearing ideas from other perspectives. And I think it also provides an opportunity to share knowledge and ideas from people from other specialties. The third is actually through our interdisciplinary care clinic. So we have an open door policy for trainees at the clinic. So ever since the time that we started the clinic, I've encouraged all of our team members to bring their trainees whenever they like. So in addition to our movement disorder fellows who are there at every clinic, we frequently have neurology residents, medical students, pre-med students, social work interns, physical therapy residents, occupational therapy students, speech pathology fellows, neuropsychology interns, and nurse practitioner students at the clinic. Not all at the same time, but whenever someone has someone rotating with them or working with them, I tell them just bring them. And some of our team members have actually also brought their colleagues along to meet the team and learn about the clinic. So it's such a rich environment for everyone to learn from each other because we all are there to help the patient, but with different angles and with different approaches. And then lastly, I would say that we take full advantage of all the resources from our foundation partners, such as CurePSP. So for example, we love the Allied Health Professionals booklet. So I've given out a lot of copies of those to our therapists to also share with their colleagues and to every patient that comes to the clinic to share with their therapists in the community.
Are there any particular misconceptions that other medical professionals might have about these conditions?
Sure. So I think there's a lot of confusion about how to recognize and diagnose them. Since these are not common diseases, many providers outside of a movement disorders or other specialty clinic may not have a lot of experience with seeing these patients, and so they may miss the early signs. And then, of course, this can lead to delays in diagnosis, which is frustrating for patients and also really important in our current landscape because it then can limit the opportunities that those patients have to participate in clinical trials, which are often limited to patients who are early in their disease course.
So I want to know a bit more about, your relationship with the Centers of Care network. And so how does UMiami, how does it collaborate with other CurePSP Centers of Care? And what have you learned from each other?
Yeah, so one of the things that I think CurePSP does really well is organize these working groups where people from the different centers of care can come together. There's multiple of them that are all kind of focused on different topics that are really important, either to diagnosis or treatment or, some aspect of management for these conditions. So several members of our center are actually like active participants in the working group, and in several of the working groups. I currently co-chair the Interdisciplinary Care Working Group. And it's been such a great opportunity to work with other people from around the Center of Care network that are also really interested in interdisciplinary care and different research questions related to it and ways that we can improve the interdisciplinary care that we deliver to our patients.
Yeah, and if a medical center is interested in starting their own interdisciplinary clinic, what would you want them to know about, what it's like to run one?
Sure. So I think my biggest piece of advice is to get to know and work within the health system that you're in. So for example, one thing that helped our team a lot when we founded our clinic was that our department already has a well-established interdisciplinary ALS clinic. So we modeled our clinic on what the ALS clinic was doing, which really helped us work with our administration, who was already very familiar with that model. So we've also had a lot of opportunities to work together with the ALS team to share resources, which has helped both of our teams. So there are a lot of different models out there at different centers based partially on what resources are available, and many of them can work well.
And sorry, switching gears a little bit back to just the Centers of Care network. So since joining in 2023, how has your clinic changed at all?
So I think we've done a better job, or I think it's allowed us the opportunity to expand a lot of the services that we have to better serve the, PSP, MSA, and CBD community. So our clinic actually serves both patients with Parkinson's disease and atypical Parkinsonism. And since becoming a CurePSP Center of Care, I think as a center, we've started getting a lot more patients with PSP, MSA, CBD. And we've been able to tailor some of the resources that we have available in our clinic specifically to that patient population.
Technology is obviously moving so fast in so many aspects of life. Mm-hmm. And I want to know if there's any specific ways that technology has kind of improved your work, the care you provide, and anything related to that.
Sure. So I think the most obvious answer is through telemedicine, which can broaden the availability of subspecialists beyond a patient's immediate geographic area. So for example, for those who live outside of a major metropolitan area or close to a CurePSP Center of Care, it's kind of widened the availability to see people who are specialists in those diseases. And not just the availability of neurologists, but other healthcare professionals as well. So for example, our speech language pathologist, who is neurotrained and very experienced with treating PSP, MSA, and CBD, offers speech therapy over telemedicine. So as a result, many patients who live far from our center who would otherwise not have access to a neuro-specialized SLP can continue seeing her for therapy, which I think is amazing. And then in addition, there's many other therapy-based assistive technology interventions that can be leveraged to improve interdisciplinary care at home. And actually, our interdisciplinary team recently published a review paper on that topic for patients with cognitive impairment and Parkinsonian disorders.
Well, what did that find?
So it was a review paper basically of all the different assistive technology interventions that are out there in the domains of physical therapy, occupational, and speech pathology.
So would you say that telehealth has been really helpful for families that live farther away?
Absolutely. Yeah.
Because I do want to know, we have an expanding centers of care network, and it's great that we're up to, I think, 38 now. It's kind of grown every year, but I know that there's still just gaps in care for people that might live farther away. So I'm always curious about ways we can address, long travel times.
Yeah, what I found through my experience, through COVID and doing telemedicine, is that I think, I have a lot more patients that live really far away from where my center is that I think probably wouldn't be able to come for in-person visits. And then the other group that I think it reaches are people with like really significant mobility problems. So one of the things that I also have seen from doing telemedicine is like I've been able to keep contact with patients that have really advanced disease that are otherwise like essentially homebound. And what I realized is that I never see these patients in clinic. These patients don't come to clinic. They can't. And I think if it wasn't for telemedicine, they would lose access to neurological subspecialty care.
Yeah, no, absolutely. Yeah, it's really funny. A different center of care director I spoke to said that, the one silver lining of the pandemic was that like we really like expanded our telehealth, and it's been really helpful for people.
Yeah, definitely. And it just made me realize, I think, how many people like were just before that just never saw neurology again.
Wow, yeah.
Yeah.
So for families that might live far away from a clinic, or, their nearest provider, their local provider does not have this sort of like interdisciplinary and coordinated care approach, how could those families best advocate for that type of care with their local providers?
So I think that's a great question. And it's something that I've come up against as well. So I think some providers who may not be as familiar with these conditions may not realize the benefits of being proactive about monitoring early for common problems that can become serious, for example, like swallowing problems. So I would say that two things that families can do would be to, number one, like learn themselves about different services that are available and then ask for the referrals. And the second would be to come to their providers with the evidence and with information about these different models. So I think CurePSP really has excellent resources for patients to bring to their clinicians to help them to learn more about these conditions and also how to optimize their treatment.